Hi, my name is Robin Parsons. I'm a midwifery lecturer, and this is a micro lecture on climate change and midwifery. Climate change has been described as the defining crisis of our time. This presentation takes the definition of climate change to be the long-term change in the average weather patterns that define local, regional, and global climates. There is growing evidence of a direct effect of climate change on health, including in the field of midwifery and obstetrics. Rising temperatures fuel environmental degradation, natural disasters, weather extremes, food and water insecurity, and economic disruption, with an associated impact on health. As reported by the World Health Organization and the Lancet Countdown, climate change can have a great impact on human health. Among those most impacted by climate change, pregnant women and their newborns are particularly vulnerable due to a convergence of environmental and social factors which lead to poor maternal and child health outcomes, especially in the global south where the effect of global heating is more acute. Extreme weather events and disasters can have a profound and lasting effect on maternal health, particularly in healthcare systems that lack climate resilience, which is the majority of healthcare systems. Disruptions in water and electricity supply can directly impact patient care, leading to inadequate support for women in labour and newborns. Gender and cultural constraints may further limit women's autonomy and mobility, making it hard for them to protect themselves during heat events. Poverty further exacerbates these risks. As women make up 70% of those living globally in extreme poverty, this disproportionately affects women. And many live in poor housing with limited access to cooling and few options to avoid working in the heat, often in physical jobs. Beyond these immediate impacts, climate change threatens women's rights to sexual and reproductive health access by disrupting the access to essential services, including comprehensive family planning and abortion services. It also increases the risk of gender-based violence and fuels harmful practices like child marriage, which are often linked to rising poverty. Take some time to look at this graphic, which can be found in an article by Ha 2022. If we think about the direct impacts of climate change on pregnancy, we can look at things like heat events, wildfires, and extreme weather events. For heat events, we can see that the frequency and intensity of heat waves has significantly increased, and pregnant women are more susceptible to heat stress. Heat exposure during pregnancy is associated with higher risk of preterm birth, low birth weight, and stillbirth. There are specific weeks of susceptibility, including the first trimester and that last week of pregnancy, and this impact of heat is likely due to heat-stressed, induced inflammatory and oxidative responses, which lead to decreased uterine blood flow and impaired fetal development. Vulnerable subgroups include those who are of lower socioeconomic status and minoritized populations. Wildfires also are increasing, and research shows that it's a really consistent association between wildfire exposure and reduced birth weight. Wildfire smoke contains a lot of pollutants which can impair pregnancy health by reducing maternal placental fetal blood flow and causing systematic inflammation. The psychological stress from wildfires, including PTSD and anxiety, further exacerbates risks to maternal health. Hurricanes and floods, which are again increasingly frequent due to climate change, disrupt infrastructure and reduce access to safe food and water. It also increases maternal stress. So studies show that women who are exposed to these events face higher risk of complications during pregnancy. Drought similarly threatens pregnancy health by causing food and water insecurity, particularly in regions with limited resources. Rising sea levels, driven by melting glaciers and thermal expansion, pose significant risk to coastal populations, which is about 40% of the total global population. Increased flooding and storm surges can lead to displacement, infrastructure instability, and exposure to hazardous chemicals, all of which pose significant risk to pregnant women. This impact of rising sea levels on pregnancy outcomes is likely indirect and contributes to the exacerbation of extreme weather events. We can also see indirect impacts through the natural environment. Climate change worsens air quality from wildfires, as discussed, and these pollutants are, of course, linked to adverse pregnancy outcomes. Warmer temperatures also extend the pollen season, which may contribute to respiratory issues. We also see that with climate change, we are going to have reduced food and water quality and availability, which will have an associated impact on maternal health. And we will also see shifts in vector and pathogen distribution. A key example here are vectors like mosquitoes, which as temperatures increase, mosquitoes can gain foothold in areas that they were not previously able to, increasing the risk of malaria, dengue fever, and of course things like Zika, which can severely impact either pregnancy or fetal health. Waterborne pathogens are also more prevalent, leading to infections that cause miscarriage, preterm birth, and birth defects. And we also see indirect impacts through social environment. So climate change-induced displacement, forced migration, and social unrest create significant stress and trauma from pregnant women. Women often bear the brunt of family responsibilities and so are particularly vulnerable during crises. So let's delve a little bit into the impact on pregnancy. High temperatures in the second and third trimester can reduce the birth rate. Infectious diseases such as Zika, malaria have a direct impact on pregnancy. The risk of gastroenteritis is increased by 28% if a woman is exposed to a wildfire in 15 days of temperatures over 30 degrees C increases the risk of atrial septal defects. We can have low amniotic fluid related, and this increase in miscarriage and pregnancy loss. So pregnant women are more prone to heat stress than non-pregnant women due to their compromised thermoregulation and homeostasis ability. The exact mechanisms linking ambient temperature to adverse pregnancy outcomes are not fully understood, but likely involve a few interrelated pathways. So prolonged heat exposure leads to heat stress, which triggers inflammatory and oxidative stress responses that promote endothelial dysfunctions and increase blood viscosity. Extreme climate events lead to a health system disruption in a number of ways. When hospital structures are damaged, they may need to be evacuated. Facilities may need to be closed, power outages may disrupt care, and damaged roads or transit systems may prevent people from getting to health facilities. When some hospitals are forced to close, others become stretched beyond their capacity, they end up overcrowded, which decreases quality of care. And of course, we have to think about the fact that storms, floods, wildfires make everyone's jobs more challenging, raising the risk of burnout. So without a rapid phase of fossil fuels, by 2100, Europe could have up to 1,000 hospitals at high risk of total or partial shutdown from extreme weather events. Analysis suggests that global warming has already resulted in a 27% increase in a risk of damage to hospital infrastructure in Europe. You may remember the heat wave in the UK where it reached 40 degrees a couple of years ago, and you can see footage online of hospitals burning. By 2100, Italy will have the highest number of hospitals at total risk or partial risk of shutdown at 137, which is followed by some other European countries, and England will have 72. And you can see on the slide that we've got potential events that would cause significant problems with hospital infrastructure. So surface water flooding, which can compromise basements where a lot of electrical equipment is kept. You've obviously got fire risk due to extreme temperature. For hospitals in London, there is potential for river flooding due to rainfall. And we also need to consider the changing demographic and how that will impact us going forward. We need to also think about long-term complications. Environmental disturbances during pregnancy and other critical development periods can have a significant immediate and long-term health effect on both the mother and the child. Women who develop pregnancy complications are at higher risk of those complications reoccurring in future pregnancies, and they also face increased chance of developing cardiovascular and metabolic diseases later in life. Babies who are born preterm or with a low birth weight are also more likely to encounter health issues, including neurodevelopmental disorders, obesity, and cardiovascular disease, which can elevate their risk of adverse outcomes through to adulthood. So thinking about the impact of the healthcare system on climate. So globally, around 5% of greenhouse gas emissions originate from healthcare. In the UK, this translates to 25 megatons of carbon dioxide equivalent admitted by the NHS each year. And reducing this is a priority for NHS England, which aims to reduce emissions by 80% by 2030. Reducing this is a priority for NHS England, which aims to reduce emissions by 80% by 2032 and reach net zero by 2040. Healthcare professionals need to engage with these efforts, and it's logical to focus on frequently occurring events. Now, birth is a very common event, and in many countries, a caesarean birth is the commonest major surgical procedure. So we need to think about the carbon footprint of birth. And what is carbon footprint? Well, the carbon footprint is a quantitative measure of the direct and indirect greenhouse gas emissions attributable to a process, product, or industry, and it's usually expressed in CO2 equivalents. A life cycle assessment, also known as a life cycle analysis, is a methodology for assessing environmental impacts associated with all the stages of a life cycle of a commercial product, process, or service. Our considerations include the raw materials that are used, how they're produced, how they're then used. We might also consider analgesia, laundry and waste, and energy and hospital stay when we're thinking about the life cycle assessment of facilitating a birth in the UK. This is a graph from a study by Nenke et al. 2024, which is an excellent paper, and I suggest you read it. And it talks about the carbon footprint of different methods of birth. So we can see that a caesarean section produces about 30 kilograms of CO2, and a vaginal hospital birth producing just under 10, and a vaginal home birth producing just over 5. So a third of this carbon footprint associated with caesarean section is attributed to the use of disposable items, and another third from the reusable items. In other areas of medicine, such as critical care, reducing the use of disposable instruments has already been explored, and we are starting to see this in some places in midwifery. So procedure packs that feature reusable metalware, surgical trays, containers and drapes have all been shown to save money and decrease waste. Ideally, all plastic disposables should be made from bioplastics or recycled materials and should be recyclable. However, really plastic recycling is inefficient. Now, it's important to think about the impact of analgesia, particularly nitrous oxide. So maternity is the highest user of nitrous oxide across the hospitals. And using nitrous oxide as pain relief during a 4-hour labour creates a carbon footprint equivalent to driving an average car for 1,500 kilometres. That may not seem like much, but you need to consider the number of births there are in the UK and how much people may use nitrous oxide. In comparison, an epidural is equivalent to driving 6 kilometres. Now, this isn't about denying women access to nitrous oxide, but we do need to consider the environmental impact of it and consider if scavenger systems can be implemented which reduce circulating nitrous oxide. It's been estimated that this can reduce nitrous oxide levels by as much as 81% and therefore cut NHS carbon emissions. It's also worth remembering that occupational exposure to nitrous oxide is associated with immediate and chronic adverse physiological effects, including decreased cognition, vitamin B12 deficiency, and increased risk of miscarriage and adverse prenatal development. So we need to think about how we can reduce, reuse, and recycle in maternity care. Can we avoid the use of single-use PPE? Can we think about the avoidance of disposable metal instruments? And can we appropriately segregate our waste? And we can also think about breastfeeding promotion. So in terms of reducing single-use plastic, an example from Kingston Hospital in southwest London shows us how the team managed to reduce their plastic waste by 115 kilos of plastic a year by stopping the use of plastic sheets on birthing bed, which they also found were having a negative impact on skin. So they had the dual benefit of financial savings and improved outcomes on skin integrity. When we think about breastfeeding on the unit, do you offer reusable bottles? Do you offer sterilising facilities, or are you using disposable teats? Thank you for watching. That's the end of this micro lecture on climate change and pregnancy. Your takeaways from this should be that pregnancy is impacted by climate change, and as midwives, our practice is going to be impacted by climate change.